This is a client presentation by Bianca Cavalieri, a student clinician at the Iona College Speech, Language, and Hearing Clinic. The client is a 34-year-old male who has been receiving speech and language services at the Iona Clinic since January of 2019 to March. Therapy had to end early due to the closure of the Iona College because of COVID-19. He presents with a diagnosis of severe expressive and moderate cognitive delays. Throughout the semester, the client attended therapy once a week for 60 minutes. One baseline session was conducted, therefore the client had 4 treatment sessions. He is also returning to the clinic. The client's mother had been a reliable informant for information throughout therapy. The client spent approximately 4 months at Burke Rehabilitation Center in 2016. He has a medical diagnosis of aphasia, severe apraxia, and dysarthria. He presents with a diagnosis of severe expressive language deficits characterized by errors with morphology and semantics, word-finding difficulties, and decreased utterance length, as well as moderate cognitive disorders characterized by difficulty identifying temporal orientation questions, mild difficulty with word-finding, and communicating across all environments. No swallowing difficulties were reported. He is not currently receiving any other services. The client received a bachelor's degree in management from Westchester Community College and was a doorman in Manhattan. The client lives at home with his mother and his father. He is single and has no children. English is the primary language and there is no family history of speech or language problems. He expressed his Italian culture throughout the therapy sessions by sharing unique traditions. The client and his family share the tradition of planting fig trees and lemon trees. The client and I were able to build and establish a relationship because we had similar family traditions because of our culture. The client was diagnosed with a central intraventricular neurocytoma in February of 2016. He received an emergency surgery to remove the tumor and a secondary surgery to complete the removal of the tumor. 2 additional surgeries were required to insert shunts, and 2 more surgeries were required to insert tubes for drainage. Speech and language difficulties were noticed after the initial surgery. The 3rd and 4th surgeries were reported to have caused motor difficulties, including right side paralysis, which has since improved. Vision loss on the right side of both eyes and underneath was also reported. He received OT until May of 2018 and PT until June of 2018. Baseline data was collected through informal observation in the scopes of voice and resonance, fluency, speech sound production, pragmatics, AAC, hearing, and swallowing. The client presented with word production errors characterized by some groping. The client presented with some speech sound production errors, most likely due to the apraxia, but this is not characterized as an articulation or phonological disorder. Baseline data was collected in the area of expressive language using WH questions. The client answered WH questions with 85% accuracy independently. Providing antonyms and synonyms was also used to assess the area of expressive language. The client provided synonyms with 28% accuracy with moderate cueing. The client provided antonyms with 100% accuracy independently. To continue to assess expressive language, the client was shown pictures of well-known celebrities and asked to verbally label them. The client labeled pictures of celebrities with 100% accuracy independently. Likewise, the client was asked to use generative naming. For example, the client was asked to name things that were hot. The client provided items in the accurate category with 16% accuracy with maximal cueing. The client was also provided with a sentence completion task. When provided with the beginning of the sentence, the client would finish the sentence with one-word responses. The client provided sentence completion with 72% accuracy. Baseline data was collected in the area of receptive language through following directions. The client followed 2-step directions with 73% accuracy with minimal cueing. Baseline data was collected in the area of cognition. The client was presented with problem-solving questions involving different situations. For example, what would you do if you lost your wallet? The client responded to problem-solving questions with 66% accuracy independently. After analyzing the data collected from the baseline session, goals were formulated in the area of expressive language and cognition. After the baseline data was collected and analyzed, it was evident that the client would benefit from therapy targeting expressive language and cognition. Therefore, I created 2 long-term goals, including to improve expressive language for functional communication outside of the clinic during daily living activities, and to improve cognition skills for functional communication outside of the clinic during daily living activities. The 2 short-term goals included the client will produce a complete sentence when responding to questions with 80% accuracy across 4 consecutive sessions provided with minimal verbal cues, and the client will respond to temporal orientation questions with 80% accuracy across 4 consecutive sessions when provided with minimal verbal cues. Therapy is justified for this client because he has a diagnosis of aphasia, apraxia, and dysarthria. He presents with severe expressive deficits characterized by errors with morphology and semantics, word-finding difficulties, and decreased utterance length, as well as moderate cognitive disorders characterized by difficulty identifying temporal orientation questions and communicating across all environments. The client was only receiving services at the Iona College because insurance no longer covered or paid for the client to receive services at Burke Rehab. As a student clinician, I would advocate for this client to receive therapy because he has a diagnosis of aphasia, apraxia, and dysarthria that affect his everyday daily living skills to be independent. Due to COVID-19, the session therapy period was cut short. Therapy consisted of 5 sessions, including 1 baseline session. Therefore, goals were only targeted for 4 sessions. The client would benefit from more sessions in order to get a more accurate deception of his communication skills. He continued to make progress in both goals targeted over the session period. To date, he produced a complete sentence when responding to questions with 32% accuracy across 4 sessions when provided with minimal verbal cues. Likewise, to date, he responded to temporal orientation questions with 62% accuracy across 4 consecutive sessions when provided with minimal verbal cues. During treatment, I targeted expressive language and cognition by using the substitutive compensatory strategy for functional communication, which includes 4 domains consisting of social communication, basic needs, reading, writing, daily number concepts, and daily planning. In order to address the client's expressive and cognitive goals while including activities of daily living into therapy, I used the walk books. There are a set of 12 of them. Some things addressed were verbal expression, calendar work, and temporal orientation. In order to create therapy more personal and address his goals, I asked the client to bring in a photo album of pictures from when he was a young child to now. This was a personal narrative. During therapy, we also targeted the goals by using wordless picture books. The client was able to verbally express a story based on the pictures he saw. Likewise, in order to make therapy more functional, I provided the client with different menus and we practiced role-playing while targeting the client's goals. The client's speech and language difficulties are severe expressive language deficits characterized by difficulty using complete, simple, or complex sentences, and word-finding difficulties during conversational speech, and moderate cognitive deficits characterized by difficulty identifying temporal orientation. The client uses Tactus therapy to help support his aphasia at home. The client responded well to a 15 to 10-second time delay approach during all activities in order to increase his independent responses. Semantic cues were also beneficial when speaking and reading. Phonetic cues were useful for labeling and word-finding activities. I have also been providing a monthly calendar and requiring the client to reference during the sessions. The client demonstrated with paraphasias throughout therapy. Since the client did not participate in telepractice, therapy should continue to target expressive language and cognition that focuses on function of everyday activities. I would continue to gain more insight on the client's interests before the stroke in order to regain function and interest back into those activities. For example, cooking. The client used to cook before he had a stroke, but now he relies on his mother to cook, and reportedly now he doesn't show interest in cooking because he can't with his motor functions. However, there are options for assistive devices for the kitchen to help aid him. This is something I would have shared with the client. One future short-term goal to target expressive language would be the client will combine at least 5 words appropriately to form sentences during conversation with 80% accuracy across 4 consecutive sessions when provided with minimal verbal cues. Likewise, one future short-term goal to target cognition would be the client will provide accurate information on time, date, and a simple schedule of activities with 80% accuracy across 4 consecutive sessions, provided with moderate verbal and visual cues. For the future, it is recommended that the client continues to receive speech and language services at the Iona College Speech and Hearing Clinic for individual sessions, 1 time a week for 60 minutes, and possibly group sessions. The next treatment period should focus on expressive language and cognition of daily living. Expressive language should be targeted by naming dates, increasing sentence length, improving writing for functional written communication, and producing appropriate responses in functional scenarios. Cognition should be targeted through identifying dates as well as temporal orientation. Progress in these recommendations were not discussed with the client and his mother due to COVID-19 and the closure of Iona College Speech and Hearing Clinic early.